The number of confirmed COVID-19 cases in Libya has increased to 49, including one death. Most of the cases are concentrated in Benghazi, Misrata, and Tripoli. We, along with our humanitarian partners, providing technical support to strengthen national surveillance and early warning and support the establishment of isolation wards in selected hospitals around the country. In the last month, nearly 19,000 medical interventions were provided, and 53 public health facilities were supported by the UN and our partners with services and commodities. And the International Organization for Migration also expressed today its grave concern for the fate of hundreds of migrants returned to Libya by the Libyan Coast Guard this year, who are now unaccounted for. Despite multiple requests, Libyan authorities have not yet provided any clear accounting as to the whereabouts of these people and why they were taken to unofficial detention facilities. And as we mentioned earlier this week, parts of the Eastern Democratic Republic of the Congo are experiencing renewed violence. This morning, the UN Refugee Agency warned that this could have terrible consequences as the country is preparing to respond to the COVID-19 pandemic. The DRC already has the largest internally displaced population in Africa, with more than 5 million people uprooted by conflict. There are also 500,000 refugees from neighboring countries. UNHCR is strengthening its regular health and sanitation activities in camps, sites, and transit centers wherever possible. The current prevention measures include temperature screenings at entry points. The agency has also installed some 365 hand washing stations and carried out an initial distribution of more than 23,000 soap bars. The agency also continues its advocacy for equal access to refugees and displaced people in the national health systems being organized to fight the COVID-19 outbreak. Turning to Asia and Indonesia, the UN is helping to secure ventilators and other essential medical supplies to fight the pandemic. According to the government there have been more than 5,500 cases and nearly 500 deaths in the country. More information on IOM's website. And I also have an update on the Locust situation in the greater Horn of Africa. The Food and Agriculture Organization and humanitarian partners are continuing ground and aerial control operations, including the treating over 200,000 hectares in Ethiopia, Kenya, and Somalia. Desert locusts continue to pose a major threat to food security and livelihoods in the greater Horn of Africa, as more swarms form and mature in northern, central Kenya, southern Ethiopia, Somalia, all coinciding with the beginning of the long rains and the planting season. The Office of Coordination for Humanitarian Affairs says that if the swarms are not contained, impacts on crops and forage will drive up hunger in areas already facing high levels of food insecurity. As of today, $116 million have been pledged towards the FAO Locust appeal, which is seeking $153 million to support our response in 10 countries. And sorry, just going back to Asia for a moment, in Nepal, 16 COVID-19 cases have been officially confirmed so far, and the UN country team there is working to address immediate health needs and the short and long-term recovery to mitigate the impact of the lockdown. We've launched a preparedness and response plan, which requires $38 million for humanitarian as well as social, economic, and recovery needs. The plan has been presented to national and international partners and will be updated shortly to include the government's own needs. The World Health Organization is working with the government on securing equipment, surveillance, and lab capacity. And we are also working with the government to answer people's questions about prevention and care, and also addressing rumors, disinformation, and stigma while promoting the prevention of domestic violence. Young volunteers from 7 provinces have been mobilized to roll out social media campaigns produced by the UN country team. And in Panama, the UN Migration Agency is working with the government to mitigate the threats that migrants face, as well as the overall risks to public safety posed by the pandemic. Panama receives close to 25,000 migrants every year who are entering mostly via the dense Darien Gap wilderness that serves as the border between Panama and Colombia. And in a statement we issued yesterday on Ukraine, the Secretary General welcomed the release and exchange of prisoners related to the conflict in the eastern part of the country. The Secretary General said that he hopes that this important humanitarian action ahead of Orthodox Easter will serve as a positive step towards more progress, including a permanent ceasefire in line with his global appeal, as well as further disengagement of forces and unimpeded humanitarian access across the contact line. That statement is, of course, online. And sadly, again today, we have to end on a sad note. One of our veteran and very talented UNTV colleagues, Damien Corrigan, passed away last night. You will know him and have seen you will have known him and seen Damien manning the cameras at the stakeout and photo ops, ensuring that you have images, the momentous events that take place in the UN building. Damien has had 35 years of work at the UN under his belt, having covered every Secretary General from Perez de Cuellar onward. He was a wizard at the teleprompter, where he handled just about every head of state during the General Assembly. He had a stalwart command of the lens, an unflappable nature, and not to mention amazing expertise at the New York Times crossword puzzle, which he finished every day. He will be greatly missed by all of us in these halls. Sincere condolences go to his family in Ireland, as well as his wife Jen and his children Jack and Kirsten, and all of his colleagues in TV production who work tirelessly behind the scenes, particularly in this very difficult period. I know that they and all of us will miss him dearly. All right, I will now take questions. Just one production note. If you want to speak, you have to have your video turned on as well as your audio. Otherwise, the system will not function properly. All right. Let's see what we have and what Florence tells me to call on. Bear with me 2 seconds. All right. Sherwin.
Hi, Steph. Hi, everybody, and condolences to you and family. I suppose we're lucky there's no briefing tomorrow because there won't be any more bad news. Steph, 2 questions. Can you hear me? Is it all good?
Yep.
The Secretary General has often talked about the UN being as strong as the collection of its parts. So I wonder if there's any concern from the Secretariat, the Secretary General himself, about the reputation of the organization, the reputation of the World Health Organization.
Sherwin, you broke up there. All right, Sherwin, I think I got the gist of your question, though I didn't hear the whole part. It is clear that the UN is a large and varied family. Obviously, it is at its heart an organization of member states. The more those member states are united, the more effective the organization will be. We look forward to strong messages of unity and solidarity from the various legislative bodies. We've all seen the reports of various discussions being held within the General Assembly and the Security Council. For his part, I think the Secretary General has been very clear and very much leading on the need for global solidarity, for effective leadership. He has put the UN machine to work, I think, on many fronts. One of these policy briefs, which should help policymakers that we've been releasing on a regular basis. Give you another example, the logistics and supply chain arm of the UN has been mobilized, and we started to see these solidarity flights in Africa. We've been highlighting the work of the UN team around. So I need you to mute your mic, please.
Hi, Steph. Do you need me to repeat, or are you good?
No, I got it. I just need you to all mute your mics. Thank you. We have seen the work, and we've been highlighting the work that the UN country teams have done in support of member states at the local level. The WHO has been leading in our medical response. They have people on the front lines providing support to countries in terms of equipment, testing kits, 1 million pieces of equipment, and as well as providing guidance to policy makers. It is important for every part of the UN, every individual part of the UN, to work in unity and to work forcefully to fight the virus. And I think that will help underscore the need for this international organization at a time of great crisis.
I have another one, if I may. Just one more. Could you just talk about how the UN has shifted in the last month in terms of its reliance on technology, some of the hiccups that you've experienced? How's this new period been in terms of readjusting how the Secretariat works?
Well, I think, and I can only speak for really what's going on here in this building. It has been a shift. It's been a shift of how we work, where we work, when we work, and I think every organization is going through this, whether it's international broadcasters, journalists, or ourselves. But I think that what has been clear to me is that under the leadership of the Secretary General, the staff has really mobilized to keep working wherever they are, and often in challenging conditions, having to juggle childcare issues and care of loved ones. But we have kept working. The Secretary General has kept his weekly meetings with his executive board, his regular meetings with the senior management group, which brings together all the leaders of the UN. It has obviously put a strain on on our technical setup, but I think, as you see from the way we've been able to conduct these briefings, and now having a back and forth, I think our technical colleagues have really stepped up to the plate. I mean, we're basically using video conferencing capabilities as TV production, but I think we're moving in the right direction. We're using all these digital and online tools, collaborative tools, and the work of the UN goes on, whether it's humanitarian work, whether it's peacekeeping, whether it's supporting member states. I think it has gone forward without much of a hitch. Edie?
Thank you very much, Steph. And first, on behalf of myself, and I'm sure the entire UN Correspondents Association, we wish Damien's family and send our condolences to them. And I know we're all very sad about his sudden death. We all knew and remember him and talked to him at the stakeout often. My question is, actually, I have two short ones and one long one. The main question is, does the Secretary General have any reaction to the announcement by China on the major revision that added nearly 1,300 fatalities to the death toll in Wuhan, where the coronavirus pandemic began? And my two other ones were, you said you were, I think you said you were going to send us the websites to track contributions.
Yeah. I think those were sent yesterday from the spokesman's email, but we'll resend them too if that was a problem.
And also, thirdly, the Secretary General didn't do a briefing this week. Is he going to do one early next week, or can you give us any indication?
Yeah, I would very much hope so. I've learned my lesson not to certify something that I'm not certified to do, but I very much hope so. Now I forgot on China. Listen, I mean, no comment on the particulars of the case, because that's really a question for scientists and WHO. What I would say broadly, I think at this time of crisis, it's very important that every member state show as much transparency as possible in terms of reporting on numbers, and it's completely understandable that numbers will be issued and then possibly revised. Evelyn?
Thank you, Steph. On WHO, Ambassador Kraft has gone out of her way on 2 interviews, radio and television, to back up President Trump's criticism of WHO. Has the SG spoken to her on the subject, or will he?
The secretary, it's not surprising that an ambassador would amplify the message from a head of state. The Secretary General has had a number of conversations with Ambassador Kraft, and I think his position on WHO in private is exactly what he expressed publicly in his numerous statements. Pamela.
Hey, Steph.
Hey,
thank you for as always. Just any reaction on the Secretary General's report and statement to the IMF World Bank? Thanks. Any back
Reaction.
and forth?
Oh, no.
Are they saying about the proposals in the report?
To use the diplomatic phrase, I would hope that his statement was warmly received by all participants. But I'm not aware. I mean, the meeting was not webcast, so we shared the remarks, but it was an invitation-only meeting. But you may want to contact our colleagues at the World Bank or the IMF.
Thank you.
Abdelhamid.
Thank you, Steph. Yesterday, Martin Griffiths, in his briefing to the Security Council, he sounded a little bit optimistic about the possibility of a positive answer to his call for comprehensive ceasefire from both parties. And at the same time, he said the war is escalating. So can you explain that? Did he receive any correspondence from both parties about possible acceptance of his initiative, which is based on 3 major points, as you know?
Mr. Griffiths is one of our most experienced mediators and negotiators, so he knows exactly what he's saying. He's also a native English speaker, so I'm sure he knows exactly the meaning of each word in English that he uses. And I have no reason to analyze what he told the Security Council publicly. I think he has been working tirelessly, and he's been in touch with all the parties on very much on a regular basis. Maria.
Thank you, Steph. Hi, everyone. I have quite bad connection today. Do you hear me?
I hear you perfectly.
Thanks. I have 2 questions. One about a high-level week of General Assembly. Is there any update about the possibilities for it to take place on September, or it can be rescheduled, or it can be held in kind of another format? Like any update?
I think that's very early. Obviously, there are a couple of things to keep in mind. One, most importantly, this will have to be a member state decision. This will decision taken by the General Assembly, the President of General Assembly. Obviously, on one hand, there's certain things, events that need to happen, and votes and meetings that need to happen. On the other hand, we will also be guided by the situation globally, by the situation in the city of New York, in the state of New York, and in the United States in general. So obviously, it's a calendar event that we are fully aware is approaching, but I have nothing to share with you at this point. You had a second question, Maria.
Yes, the second one is about the unilateral sanctions. What Secretary General position is on this, that some countries, including Russia, which are under unilateral sanctions, they're approaching like the apex of pandemic, and the situation is getting worse. So, but
I mean, I think the Secretary General has said publicly, and I think I've said it a number of times in the last month or even more, that we believe that sanctions that are impacting countries' ability to cope with the COVID outbreak should be lifted, and the Secretary General has had conversations in that sense with a number of member states. We will not be able to win against this virus until all of the health systems are able to deal with it successfully. So this has been the Secretary General's position, and he has said so both privately and publicly. I have a question from Iftikhar, who says, will the SG be making an appearance in Saturday's virtual WHO Global Citizen One World concert to raise funds for health workers? Iftikhar, thank you for the question, because it's something I should have flagged proactively. Yes, very much so. The Secretary General and the Deputy Secretary General have both recorded messages that will be aired during the stay-at-home Global Citizens concert. We'll try to get you embargoed copies of those messages later today. And I had a question that was emailed to me from the Tribune Online in New Delhi about the Secretary General's reaction to India's efforts to send medicine and other supplies to other countries around the world. I think the answer that I give you is the same I gave to our Cuban colleagues yesterday, is that the Secretary General calls for global solidarity in this struggle against the virus. And that means that every country who is in a position to help another country should, and we salute those countries that are doing so. Any other, Oscar, no. Sorry, I don't see any other.
I sent you a written question.
Okay, let me. Can we express Reem? Can we expect Reem to join these briefings? I would be happy to have her. We may have to have separate briefings because it's so difficult to switch back and forth. But we will reach out to her, and you should reach out to her as well, because I'm sure we would all love to hear from her. Anyone else?
Did you receive my memo?
Go ahead, Gloria.
Hello?
Yes, go
it's
ahead.
an important memo that there's a Chicago company that has made a very big breakthrough. It was announced to me yesterday. It's called Gilead, Gilead, and they have an effective treatment for the virus. And already the stock market is zooming on. I thought it would be interesting.
I have no medical expertise, and I don't pretend to have any. So that's really not a question I can answer. You may want to direct that question to the experts at the World Health Organization.
Okay, thank you.
You're welcome. Anyone else? All right, take care. Enjoy however we spend our weekends in lockdown, and we shall see you on Monday. Cheers.